Doc on the Run. We help injured runners run.
Okay, when you get injured with something like plantar fasciitis, there really are lots of things you can do, but there is one thing that's most important. Now, healing, if you think about it, it really is a lot like training for a marathon. When you're training for a marathon, you need to run, you need core strength, you need to do planks, you need some time in the gym, you have to do some weight workouts, you have to do lots of different things. But of all the things you could possibly do to help get you ready for a marathon, if you had to choose one, wouldn't it be to run? I mean, don't you agree that's the most important thing? You have to have your running fitness in shape. You have to be ready. You have to be prepared. And most of that comes from running. Now, the same's true when you're healing plantar fasciitis. You have inflammation, you have pain, you have tightness, you have lots of issues that contribute to the condition that we call plantar fasciitis. But there is one thing that is most important by a mile, and that is stretching the Achilles tendon. Now, there are lots of ways to stretch. You've probably seen 100 different stretches. Some of them are good and some of them are bad when you have plantar fasciitis. Now, we talk about all this in detail in the Runner's Heel Pain course, but there are really two ways that I really think are most effective for stretching the Achilles tendon. And one of them is to do a simple stretch at home 3 to 5 times a day. And if you go to the show notes page of this episode, you can get the video. I'll show you exactly how to do it. It's a video lesson from the Runner's Heel Pain course, and it'll show you exactly how to do the most effective stretch for plantar fasciitis. Now, the other way, which is even better, is to use the Aquinas brace. This brace is extremely effective. Now, I'll tell you, it's expensive, but it works. So go to the show notes page if you want to get the free lesson on the stretches. And if you do those stretches and then you're not better, you're not getting better quick enough, you can always use the Aquinas brace. And we have a special thing for our listeners where they've agreed to give all of our listeners free shipping if you just enter Doc on the Run, all one word, all caps, in the promo code when you check out for the Aquinas brace. Now, a lot of people ask me, well, they don't get it. They don't understand why the Achilles tendon. They say the pain is in their heel. It's not in their Achilles tendon. They don't understand. So the Achilles tendon is really what causes plantar fasciitis in runners. So part of the thing is that the tight Achilles tendon, some of those fibers wrap all the way around the heel and blend in with and are contiguous with the plantar fascia. And when you get plantar fasciitis, it's because your Achilles tendon is too tight and it basically forces you to pronate more, which puts more stress on the plantar fascia, and then you get plantar fasciitis. So most runners have tight Achilles tendons. And in the last 15 years or so, of all the runners I've measured to check them to see how much measurement in terms of dorsiflexion at the ankle, that is how we determine whether or not you actually have a tight Achilles tendon, I've only seen 3 runners, 3, who have what we think of as being the normal range of motion and a normal sort of pliability to the Achilles tendon. So I don't really think it's fair to say that every runner needs to have normal pliability or normal range of motion with the Achilles tendon, but I do think it's fair to say that if your Achilles tendon is tight, it's much more likely that you're going to get plantar fasciitis, and it's also much harder to treat the plantar fasciitis if you don't address the Achilles tendon. You have to do something to address the Achilles tendon. That's crucial. So again, there are lots of ways you can do this, and there are lots of different treatments for plantar fasciitis. You've probably heard already about lots of different possible treatments: icing, injections, night splints, wearing compression socks, elevating your foot, stopping running. That's one I hear all the time, which of course most runners we want to run. We don't want to stop running. So when a doctor tells us, oh, just stop running, this condition's self-limiting, it'll eventually go away if you just stop running, that's sort of a half truth, and it's not really the whole truth. And so doctors will recommend lots of different things. Most of them are expensive: injections, splints, surgery, custom orthotics. And most runners do not need custom orthotics. Most runners do not need injections. And I don't inject runners as a routine when they have plantar fasciitis for several different reasons that we talk about in the Runner's Heel Pain course. I think I have actually other podcast episodes where I've talked about why you don't really want to have an injection when you're a runner in terms of a corticosteroid injection, unless it's absolutely necessary. And most of the time, it's not absolutely necessary. But of all of those things, all of those possible treatments, all the things that you could potentially do to get rid of your plantar fasciitis when you're a runner, stretching the Achilles tendon is by far the most important. So just go to the show notes page of this episode and I'll show you. I'll give you the video. It's a video lesson from the Runner's Heel Pain course. I'll give it to you for free. You can just get it. And most runners, I believe, who do those stretches consistently will be able to get rid of their plantar fasciitis just by doing that. And it doesn't mean you have to stop running. while you're healing your plantar fasciitis. Again, there is a faster way, it's a better way using the Aquinas brace. That's one that I use myself. I have one. The Aquinas brace is more helpful because you don't have to use it an hour a day. You can use it while you're watching television, while you're working on a laptop, whatever. You can get free shipping if you want to get that. But either of them will work. So go to the show notes page for this episode and get those links and get started right now. So the sooner you get started on healing your plantar fasciitis, the better. And you do not want to wait. When you have plantar fasciitis for months and months and years where it's just kind of bugging you off and on, you actually get degeneration of the plantar fascia that makes the condition worse. Not only does it get harder to treat, it actually changes the collagen in the plantar fascia. So you don't want to wait. You do want to treat it right away, not just because it's annoying you when you get up and step out of bed in the morning, not just because it's annoying you when you go for a run, but because it will get worse over time. But it's a simple thing to fix. You can address it on your own. Most people can fix plantar fasciitis without ever seeing a doctor. Go to the show notes page, check it out, get the lesson, and then get started today so you can get back to running without any heel pain.
Doc on the Run. We help injured runners run.